I had been having some numbness and tingling in my arms for a while, for about a year. Then I kind of noticed an uptick in my symptoms and my whole side was numb. So I got up and I was trying to move my arm, trying to get the blood flow back in there. And my husband asked me a question and I tried to answer him and I couldn't make words come out. We went to the emergency room and the doctor came in and let me know that I had had a stroke. She saw other strokes that I didn't even know that I had had. And then she mentioned Moyamoya.
Moyamoya is a rare, progressive condition of narrowing of the blood vessels within the brain. These blood vessels are the main highways that help promote blood flow into the brain. And what can happen in affected individuals is these blood vessels can narrow over time.
And as a consequence, there is less blood flowing into the brain that can cause strokes. The brain, in turn, tries to compensate for this progressive narrowing and creates these new, tiny, fragile vessels that they're very delicate and can burst, causing brain bleeds.
The word moyamoya comes from the Japanese meaning puff of smoke. There ends up being an explosion of all these tiny blood vessels that look like a puff of smoke when you were to image it. There are multiple causes that we are aware of that can cause narrowing of these blood vessels over time. We're learning about new gene mutations every year that are associated with this condition. We are also learning about a variety of other associated conditions that can mimic this disease. Things like blood disorders, chronic infections, inflammatory disorders, and they can have very similar characteristic blood vessels. That's part of the reason it's very important to work with a clinician who's experienced in this area to help differentiate Moyamoya disease from one of the variety of different mimics. These mimics are fundamentally treated differently than the disease itself. When it comes to medical management, what we try to focus on are what are the things that are under our control to help treat moving forward. So really targeting the fundamentals of stroke, which are things like high blood pressure, high cholesterol, diabetes, exercise, diet, and really trying to identify strategies to help optimize all those factors. Most patients with Moyamoya disease also require a blood thinner in order to prevent clotting within the brain. Once we have been able to maximize all the medical treatments, we start thinking about whether there may be surgical options for them.
The main goal of surgery for Moyamoya disease is to increase the blood flow to the brain to prevent strokes in the future. Patients that benefit the most from surgery are those patients with Moyamoya disease presenting with strokes, like difficulty talking or moving or feeling, or when we are following them over time and they are not having symptoms, but we can see that they have new strokes in the CT or MRIs of their brain, or when we see that the arteries are getting more and more narrow over time. During surgery, the surgeon makes a direct connection between one of the arteries of the scalp and one of the arteries of the surface of the brain. And that is what we call a direct bypass and provides immediate blood flow to the brain. These arteries are about 1 millimeter in size, and we have special microscopes where we can inject fluorescent dye and then see how it's flowing from the scalp artery into the brain. This ensures that the bypass is functioning well before we conclude the surgery. In addition, during the same procedure, we lay over the brain other scalp arteries or vascularized tissue, like muscle, in the surface of the brain. And that is what we call an indirect bypass. And over time, the brain grows in new arteries that are going to provide more blood flow. It's like putting fertile, moist soil next to a plant that needs more water. Eventually, it's going to grow roots inside that soil. That takes several months to occur, but when it happens, it's a very lasting option to provide blood flow to the brain. Typically, patients remain in the hospital the day of surgery and an additional 2 or 3 days before going home. Most of patients, they are back to their normal activities at the time that they go home, and they can go back to work after 10 days to 2 weeks. Frequently, we see patients that present with symptoms and narrowing of the arteries only on one side of the head. But we know that at least half of them, eventually, they're going to have signs and symptoms from progressive disease on the other side. And that is important to follow them at least every year so we can detect those progressive changes like narrowing, so we can do surgery on the other side before they start having strokes. Bypass surgery is a very successful procedure. Most of patients after surgery can live a normal life without further strokes. Moyamoya, when left untreated, is a very disabling disease. Many patients, they go on having more and more strokes to the point that they are disabled, and all that can be prevented by doing a complex but highly successful surgery at the right time.
So before I had my surgeries, my brain would literally stop working in the middle of a sentence and I couldn't remember what I was trying to say. I had really bad numbness. It started to be in both arms instead of just my left side. And since the surgery, I feel great. I feel so much better. The care that I got at UCSF was great.
At UCSF, we have a dedicated Moyamoya clinic where neurologists, neurosurgeons, rehab experts, radiologists, we work all together.
And having this team-based approach offers patients the ability to have multiple experts weigh in on their care about what the best treatment strategy may be.
Moyamoya disease is a condition that cannot be cured, but can be managed over time.
This is a condition that someone can live with if they are good about taking their medications, if they're good about checking in with their physician about symptoms they may be having, and if they are motivated to stay active and stay healthy. Patients can live long, really productive lives with this condition.
I'm actually going on a cruise to Hawaii with my mom and my sister. I'm just looking forward to moving forward and enjoying my life.